Just up. So right now for the COVID-19, I'm a contact tracer supervisor.
I became the lead for the isolation and quarantine team because they recruited me. I jumped right in.
My title is co-lead on the isolation and quarantine team.
There's also something called case investigation. So that's basically talking to the positive client, and then from the positive client we get the contact tracing. So that we basically when we're doing the interview with the patient, we help them recall everyone with whom they have had close contact, and during their time frame of their infectious period. And from there, we get contacts, and that's where the contact tracing is so important. Then the contact tracers warn the exposed individuals of their exposed individual contacts of the potential exposure.
So how do you get the information that people have tested positive for COVID, or how do you initially get like, hey, I need to start tracing this specific person?
Yeah, so we get those reports typically from labs and providers, and they get inputted into a database called the California Reportable Disease Information Exchange Database, which is used to monitor all communicable diseases across the state in California. And so those results get inputted into this database, and then we are notified of positive cases that come in. And we have a separate team that notifies our team of those positives so that we can interview them, place them on isolation and quarantine.
Can you kind of tell me what exactly you're doing when you reach out to folks?
So we first hear about a new patient from the intake team after someone is tested positive, they become a confirmed patient. So that's the first person we call because we have their phone number, and that's usually all we have. And sometimes we don't have their phone number, so we have to get the district attorney to help us find a new phone number, the current phone number for the person. Okay. So once we're in touch with them, then they give us their contacts, anyone who they've been in touch with in close contact, that would define them possibly being infected by COVID. So then once we get those contacts, then we call them, but we make sure to remain confidential when we call the contacts. We don't tell them who we got the information from. We just tell them that they've possibly been exposed to COVID-19. So then we place the contacts in quarantine. And the patients go into isolation, which means they separate from people in the household, they're in the live, and the rest of the household is on quarantine, not to leave the house and to stay separate from the positive patient.
Yeah, I think one of the main thing is why the tracing is so important, or why my job is important, or why public health is so important, is that we need to isolate infected people so they don't spread the disease to others. We need to identify and test and isolate contacts who have COVID-19 symptoms. And then we also have to watch. So one of the things that the contacts do, we have to watch for the symptoms by checking in with contacts who do not have COVID-19 symptoms. And sometimes we're calling every other day just to, see that, hey, how are you doing? Are you experiencing symptoms? And if they are, they need to get tested.
Contact tracing is very important. It's very important because this virus it spreads fast, and it spreads, it spreads quickly, and it spreads within our own households, and it affects vulnerable populations, and that's something that we need to take into account. It's not just the elderly that should be concerned about this virus, and with contact tracing, I think it just really further emphasizes the fact that it's not just, we can't be concerned about just our own health, and that there's others who are impacted by the actions that we take. Me choosing to isolate myself if I have the coronavirus is me trying to protect my mom, protect my family, and I think that we all want to protect the people that we have in our lives who are close to us. And so I think that's a big reason why it's really important. And we ultimately want to limit and reduce the spread of this virus because we want to get back to normal life. We want to get back to a sense of normalcy and resuming the activities that we used to do and hanging out with our friends. I mean, I know I do. So, if we can get, and try to work to reduce this virus and, maintain our social distancing and our hygiene practices, hand washing, we can hopefully, get move forward in our phases of reopening.